Parents of female teenagers, listen up. The Wisconsin Department of Health Services is reporting a 400% increase in toxic shock syndrome cases. New at 10, McKenna Alexander breaks down the similarities between those cases. McKenna?
Yeah, some alarming numbers today from the State Department of Health linking a majority of this rise in toxic shock syndrome to tampon use among teenagers.
Since this past July, the State Department of Health Services has received 5 reports of toxic shock syndrome, with 4 of those associated with tampon use by teenage girls. It's been over 10 years since the state has seen multiple cases of TSS. Typically, there will only be 1 or 0 annual cases. DHS officials do note that the one similarity they found among the 4 tampon-related cases was the use of the super absorbency type. The tampon's brand, though, differed. Medical experts with DHS say it's difficult to know whether this recent increase in cases is a coincidence or if it points to a larger issue. They stress they're just working to raise awareness that TSS is real and can be serious, though luckily none of these recent cases have been fatal.
In a state of 6 million people, and you see 4 cases in a 6-month period, that could just be to chance. It's a coincidence, or there could be some underlying causes. Maybe people are less aware of the risks associated with prolonged tampon use than they were in the past.
Regardless of the underlying cause, though, they do say women should continue using the products best suited for them.
When this problem was first identified several decades ago, the tampons available on the market were made safer with regards to this product, with this disease. So people don't need to necessarily change their behavior. We want to caution people against leaving them in for unusually long amounts of time.
Dr. Westergaard went on to reinforce that clinicians and parents should be on the lookout for the symptoms of TSS, which include fever, low blood pressure, fainting, and rash.
For more information on a toxic shock syndrome, visit dhs.wisconsin.gov.